Hi everyone, welcome back to SG Dr. Wellness. My name is Dr. Chen Yiming. This is the last video of the 4-video series on HIV, and if you haven't watched our first 3 videos, please click on the link on the top right of your screen now to access the playlist. In the finale of the 4-video series, I'm very happy to have Dr. Wong Chen Seong, an infectious disease specialist, the Deputy Director of Singapore's National HIV Program, NCID. He has very kindly agreed to join us in this Q&A interview tonight. So let's go straight to the questionnaire. So, hi Dr. Wong, good evening. Thanks for sparing some time for our interview today. So we'll go straight into Q&A. Alright, we'll start with question number 1. We know that the vast majority of HIV transmission is through sexual interaction. How would you rank the rate of transmission of these various sexual activities? The first, oral sex; second, anal sex; third, vaginal sex; and last, kissing or making out.
So thanks for that question. I think you're exactly right in that different sexual acts have different risk of HIV transmission. If we were to rank those activities that you listed, probably the highest risk would be that of unprotected anal sex, both receptive as well as insertive anal sex, followed by unprotected vaginal intercourse. Really much lower down in terms of risk would be oral sex, which we generally accept to be very, very low risk unless there is very obvious bleeding, or other wounds or ulcers in the mouth or the oral cavity. And we don't consider kissing or hugging or other forms of casual contact as carrying very much risk at all. Okay. I think it's important also to understand that the risk of HIV transmission is only if the HIV positive partner is not on treatment and has a high viral load in their system, and hence there is virus to transmit. For people who are undetectable, the risk is really low.
Okay. So for unprotected anal sex is of the highest transmission. Could you share with us what is the reason why that is so?
I think a lot of it has to do with the anatomy. So we know that the mucous membrane, or the inner lining of the rectum and the anus, does get injured more easily, especially during the sexual intercourse or the act of sexual intercourse itself, and hence it is much more vulnerable to being exposed to blood or other sexual fluids that may contain the virus in them, and hence transmission can take place.
Right.
But once again, it's really only a risk if the HIV positive partner has a detectable viral load if they're not on treatment.
Right. So, in terms of using a proper usage of condom, would you like to share with our viewers what is the sort of figures in terms of reduction of the rate of transmission in terms of anal sex?
So, the correct and consistent use of condoms is actually carries with it a very, very high level of protection. The experience, and we've had many, many years of experience with condom use and how much they can reduce HIV risk. And most studies and most experts will agree that it's in the neighborhood of 90% reduction and more as compared to unprotected sex, whether it's anal or vaginal.
Based on MOH's website on the update of HIV, there were about 261 new HIV infections reported in the year of 2020. 92% were male, 48% was homosexual transmission, and the other 52% were bisexual or heterosexual transmissions. So the stats are actually fairly even between homosexuals and non-homosexuals. However, there are a lot of stigma out there that the homosexuals, in particular gay men, has a higher risk of HIV transmission, right? Is there any truth in that? And if yes, why?
So I think once again, it may help us, or it's quite important for us, perhaps not to attribute risk to particular individuals or to groups, but rather attribute risk to behaviors, right? We were just talking about the risk of different sexual acts and the risk of HIV transmission that each of them has. And so I think it's much more helpful for us to think about what the risk is of a particular behavior or a particular sexual act, especially if it's unprotected, regardless of whether it is undertaken or happens to a man or a woman, or a man who has sex with men or a man who has sex with women. Moving away from attributing risk to individuals or groups, I think, is an important step that we can take to reduce the stigma that's experienced by both people living with HIV, but also people at risk of HIV, including gay, bisexual, and other men who have sex with men that you were pointing out. And reducing stigma overall actually has been shown and proven to improve efforts at reducing HIV transmission and reducing stigma overall.
Right. Okay. Now, the next, in terms of testing for HIV, what is currently the gold standard used for the screening of HIV? And secondly, which groups of patients belong to the high-risk groups? And for those patients, how often would you recommend a screening test for HIV?
So, the gold standard, which is used nationally in Singapore, is a fourth generation HIV antigen antibody immunoassay. So it's a fairly complicated name, but what it basically means is that in this test we are looking not only for the anti-HIV antibody, but also for what we call the P24 antigen, which is a component of the viral of the virus itself.
Right. So
this essentially shortens the window period for testing to about 14 to 21 days. Beyond or after the point of HIV exposure. So it's really shortening the window period, increasing the accuracy of the test. The frequency of testing for high-risk individuals or people who have high-risk behavior rather is generally, we recommend both nationally as well as internationally to be at least every 3 to 6 months, with some variation depending on the specific individual and the specific setting. And once again, the high-risk behaviors which should encourage or which should promote more frequent testing would include maybe having multiple sexual partners, not being able to use a condom consistently and correctly, or perhaps having a partner who's HIV positive and not yet achieved a undetectable viral load.
In the event somebody is tested positive for HIV, could you run through with us what are some of the immediate steps that you usually go through with the patients in the first 2 or 3 consultations or encounters?
So I want to sort of have a disclaimer here. What I'm going to talk about is really what happens when people come to seek care at the National Centre for Infectious Diseases, which is where I work and where I head the program. Generally speaking, most people in Singapore who test positive for HIV don't test positive at a hospital or a HIV clinic, right? They test positive at a GP clinic or an anonymous testing site and so on.
That's right.
If they do test positive and they want to seek care, they are then given a referral to a hospital, such as at the NCID. Now, once we receive such a referral, we generally will see all patients within 7 to 10 days, right? It is a target that we set ourselves because there is a lot of evidence to suggest that the sooner people see a doctor and start care, the better their long-term outcomes are.
Okay.
On the first day that someone comes to see me, I will do the usual thing that a doctor will do, which is take a complete history, do a physical examination, so I have a better idea of how they are, what their concerns are, and then also do some investigations, right, which may be blood tests, x-rays, and so on, which will give me a better idea of where they are with their health, especially in terms of their immune system, right, so their viral load, their CD4 count.
Right.
After this, a discussion will be had about starting treatment as soon as possible. Local guidelines recommend that we start people on HIV treatment within 7 to 14 days as much as possible. Okay. Now, apart from seeing me, they also see other experts. They will see a pharmacist who will counsel them on being adherent to therapy, as well as making sure they're not taking any medications that could interact with their HIV meds. They'll also have a conversation with their medical social worker who's there to provide supportive counseling. The next few visits with me are really just to make sure HIV treatment is proceeding as planned. They're not having any side effects. And that's generally what happens in the first couple of visits. Of course, underpinning all of this is ensuring that patients are okay and that they're coping well with their diagnosis.
Next, we know that there are anonymous testings available in Singapore. In the event some of these anonymous testings becomes positive, are the clinics and test centers, are they obliged to reveal the identity of the testers to the MOH National Registry for HIV?
So anonymous testing happens in Singapore at 10 sites around the country. The biggest is the the Action for AIDS Anonymous Test site. The other 9 sites are GP clinics that are distributed around the country. And anonymous testing was really implemented to reduce the barriers to testing that some people may have about having to give their names and their other particulars to get HIV tested. Now, by nature and by regulation, if they are anonymous, even if they test positive, these individuals will not be notified, or their test results will not be notified to the National Registry.
Yeah. Okay.
But I think it's also important for us to understand that the purpose of the National Registry is really to allow us as a country and as a health system to understand where we are going with the HIV situation, which will then allow us to implement the necessary measures to reduce HIV transmission in the country. And every effort is taken to protect the confidentiality of people who test positive and are notified. We also need to know that we do recommend that everybody who gets tested positive sees an HIV doctor and starts treatment. And if they do decide to start treatment, they will need to be notified in that case.
Okay, right. Now, the next question that I'm going to ask is about prevention. Okay. Would you be able to rank for me the importance of these methods of prevention of HIV? A, usage of condom. B, having sex with someone of the same HIV status. Or C, usage of pre-exposure prophylactic medications.
So I actually don't think it's that useful for us to rank how effective different methods of prevention are. I think it's actually much more useful for us to see that all of these are different strategies that we can use in an overall HIV prevention strategy, right? Sure. All of these different measures are highly effective in their own rights, be it the use of condoms, which, as I told you just now, could be up to 90+%. The correct and consistent use of pre-exposure prophylaxis as prescribed has been shown in studies to be almost 95-96% effective if they are used properly. And of course, knowing your own HIV status is so important, and if possible, the HIV status of your sexual partners as well. But we shouldn't really be taking them individually and choosing which one is most effective, because actually when they're used together, or at least if they're considered together, they could be much more effective as a whole.
As a whole. All right. Yeah. Okay. So coming to the topic of PrEP, so you and your team penned the latest guidance on the prescription of HIV pre-exposure prophylactic medications back in 2019. Do you feel that enough people know about PrEP at the moment? And how big or how strong is PrEP in the prevention of HIV transmission? I mean, its role, how big a role is it at the moment?
So, as you rightly pointed out, my team and we wrote the guidelines on the prescription of HIV pre-exposure prophylaxis. Yeah. It's actually available now, published by the Singapore Medical Journal. You can access it. We know from our some work that we have done in the local setting that actually the knowledge of HIV pre-exposure prophylaxis, even amongst people who might most benefit from it, those who are most at risk of HIV infection, is actually not that high, right? So we can definitely do a lot more and work a lot harder in getting knowledge and awareness of PrEP out there. PrEP, in a summary, is basically the use of HIV medications by people who are HIV negative in order to prevent transmission. And we have seen from sort of global data that it is very, very effective if used correctly, and if enough people who are at risk are able to use it. Right. So definitely its impact could potentially be very great. If more people are aware of it, more people are able to access it and use it.
There are now many antiretroviral therapies in Singapore. So how much, just a ballpark figure, is the average cost for a month of antiretroviral medications for a typical HIV patient in Singapore before subsidy?
So that question is actually quite tricky to answer because there are many different types of medications, right? There are more than 20 individual drugs that are available that are effective against HIV, and we will need to give patients a combination or a regimen of different medications. Yes. And hence, because there's so much variation, the price and the cost to the individual patient can vary quite widely as well. You know, from the low hundreds all the way to significantly more than that. And this is, of course, as you pointed out before, the subsidy.
Right.
So a lot of it really depends on what the individual patient's needs are, and at least in Singapore, regardless of the cost of the medication, there are multiple, ways in which we can get patients access to the treatment if they need it.
All right. Now, we know that there's this list of 16 ART drugs available on the list of subsidized HIV medication since September 2020. What impact does it have on your patients who are receiving the treatment now? And have you seen an increase in the numbers of patients who are here to seek treatment due to the cost saving from the subsidies?
So I think the main impact to the individual patient is, of course, now with the subsidies, medications cost much less, so much less out of pocket. And that is bound to, be a benefit or something that they can enjoy. It also means that medications have become that much more accessible just to all patients who need it. As for the impact it has on people coming forward to seek care, it is a little bit early for us to be able to monitor and evaluate that. As you pointed out, it only came into effect in September 2020, which is sort of a year and a half ago. But having said that, our team, at the national program, we have started to do some work in seeing whether or not it has resulted in more people coming forward to seek care and the impact it has on the overall care continuum. But that work is ongoing, and we hope to be able to sort of report on that really soon.
Yeah, as primary physicians, we hope that there's an improvement in terms of the number of patients seeking treatment too. So I've spoken about U equals to U in my third video, okay, which is undetectable equals to untransmittable, in the sense that if a patient has an undetectable viral load, he or she will, the risk of transmission is almost close to zero. Now, what would you say to somebody who has an undetectable viral load at the moment and feels that he or she has now the license to engage in unprotected promiscuous activities, sexual activities?
So I think the first thing I would say to that is that was never the intent or the intention or the philosophy behind U equals to U. U equals to U, or undetectable equals to untransmittable, as a concept and as a slogan really came about from a need to spread two messages. I think the first message is that HIV treatment or antiretroviral therapy is available, it's accessible, and it's highly effective in reducing the viral load, which has a great impact on the individual's own health, as well as reducing the risk effectively to zero of transmitting the virus onto other people.
Right.
So it's to increase that knowledge, right? And the second is to reduce the stigma, because we do know that a lot of the stigma surrounding HIV comes from a fear of transmission, a fear of passing the virus on to someone that that the person loves. So the message here is really of engagement, engaging people, educating them and enlightening them of these changes, of these advances in HIV, and to try and chip away at all the stigma and discrimination that's built up over the years around HIV. I tell my patients this because it allows them to understand that they can go on to start families. They can go on to have meaningful physical and intimate relationships with the people that they love, all of which are natural, normal parts of everyday life. I also, do tell them that it does not mean that they are no longer at risk of other sexually transmitted infections, which can take place if it's unprotected sex, and also unplanned or unwanted pregnancies as well, all of which need to be discussed. So I think that is how we generally approach the message of U equals to U with our patients and our clients and friends.
Right. Well, okay. Thanks for your time, Dr. Wong. There's a lot of questions that we answered and very, very long, great replies. Do you have any last parting words, message, or advice to our viewers on YouTube and the general public as a whole in terms of HIV and our nation's HIV effort to reduce transmission?
So I think first of all, I wanted to thank you for taking the time and inviting me here to share. I think it's during opportunities like this that we get to talk about HIV, that we hope to reach out to people.
Yes.
And the listeners and the watchers get a sense of the changes and the advancements that have been made with HIV. And understanding and knowledge is always the first step to acceptance, I think. And the second thing is that each and every one of us, I think, has an opportunity and has a role to play in reducing the stigma and discrimination faced by people living with HIV, just as people who live with other chronic diseases may and experience some of this stigma as well. It's exactly the same with people living with HIV. And if we can learn something and tell someone else, even if it's just one other person, something that we've learned or something that we know, I think those are all steps at reducing the stigma that people living with HIV continue to face even today.
Okay, great. Thanks for coming again. So for all our viewers out there, so we hope you learned a lot more about HIV and to break the stigma about HIV. Share this video with anybody who is interested in this topic. And till the next time, stay safe and stay healthy.